Welcome to Oncology Data Advisor. Today we're here live at the ASCO annual meeting in Chicago, and I'm joined by one of our editorial board members, Dr. Richard Riedel. Thanks so much for coming on today.
Absolutely. Thanks for having me.
To start off, would you like to introduce yourself and share a little bit about what you do?
Sure. So my name is Rich Riedel. I'm a medical oncologist at the Duke Cancer Institute at Duke University in Durham, North Carolina. I focus in clinical interest in bone and soft tissue sarcoma.
Awesome. So we really enjoyed the Sarcoma Task Force that you were one of the co-chairs of this past month. How have you enjoyed working on it and collaborating with the other panelists?
Well, the first thing I would say is that the sarcoma community in general is small but a welcoming group. And so all the individuals that participate in the task force are individuals that I've had the pleasure of knowing for many years and interacting with. We had medical oncology involved, we had radiation oncology, pathology, surgery, and that's consistent with the way we treat these tumors, which is in the context of a multidisciplinary care team.
Right. What are some other things you're looking forward to discussing that you also discussed during the live panel that you'll be talking about in the position statement as well?
So the position statement really is designed to try to give a general overview on the management of dedifferentiated liposarcoma, and it'll touch on a number of aspects, including incidence, presenting symptoms, importantly the pathology and the need for pathologic expertise in terms of making a diagnosis. And then we talk about the multidisciplinary management, both in terms of local control for localized disease, as well as currently available and hopefully novel systemic therapies for patients with metastatic disease. So we hope to cover all of those aspects.
Awesome. Looking forward to reading it. Here at ASCO, what is some of the notable sarcoma research that you've seen that's being presented here?
So tomorrow, Monday, is actually the oral session, and there are a couple of abstracts that are particularly of interest. The first is from the MOTION study. MOTION is a study that's looking at the use of vimseltinib, a small molecule inhibitor in tenosynovial giant cell tumor. That is a phase 3 randomized controlled study versus placebo. And what we've seen from the abstract and what we will hear in the oral presentation is that the overall response rate was improved compared to placebo, an overall response rate of about 40% compared to 0% in the placebo, as well as a very favorable side effect profile and improvement in a variety of patient outcomes, including things like pain, stiffness, range of motion. So that's a nice study that we'll hear about. We're also going to hear about the results of SARC-032. That's actually a study that was formed at our institution at Duke and then brought to the international community. It was 126 patient study looking at the use of pembrolizumab in combination with radiation therapy and surgery, followed by adjuvant pembrolizumab for up to a year, specifically in patients with stage 3 sarcoma, so high-risk sarcoma, and that was compared to the standard of care, which is radiation and surgery alone. And what that study shows is that there's a significant improvement in 2-year disease-free survival that appears to be particularly in patients with grade 3 sarcomas. So that data will be presented by Dr. David Kirsch.
Awesome. Thanks for sharing these updates. Are you involved in any studies that are being presented here?
The SARCO-32 data we're involved in, and there are a number of posters that I have the honor of being a co-author on, particularly around additional analyses from the DeFi study, which was published a couple of years ago looking at the use of nirogacestat in desmoid tumors.
Awesome. So with all these new directions that are being explored in the treatment of sarcoma, what are you most looking forward to seeing in the next few years?
Well, I think what I'm most enthusiastic about is the fact that there's actually growing interest within the rare disease, in a number of rare disease states, including sarcoma. And so we are now looking at studies that are looking at novel injectables. We're looking at immunotherapy combinations. We are looking at novel TKIs, antibody drug conjugates are coming into play. So there's this swarm of enthusiasm in a disease state which really has limited options. So I'm really excited for what the future holds.
Awesome. As we wrap up, anything else you'd like to mention about being here at ASCO or about the sarcoma research here?
Well, ASCO is an amazing meeting. It's 30,000 of your closest friends coming and learning about oncology for 3 or 4 days, and Chicago is a wonderful city. And importantly, I think it's nice to actually be in person. I mean, we're still trying to climb out of the pandemic, but to have these interactions with colleagues that you've worked with for years is very meaningful, in addition to the amazing science.
Absolutely, and we worked with you on the board for a couple of years now on the task force, so it's great to be here in person and to meet as well.
Absolutely. Thanks for having me.